Good evening, everyone. We'll begin shortly. Good evening, friend. Good evening, Doyen.
Good evening. How's everyone?
Good evening. Good evening, Derek. Good evening.
Yeah, good evening, everyone. Just give me 1 minute. I'm just trying to get a table to get myself sorted out. I'm at the Bedford Armory. So just give me 1 minute, please. Good night, Mia.
Hey, friend. Good evening.
Good evening. Oh, wow. Thank you. Okay. Put on the camera. Okay. Okay, let me see if I can get through to Anna. Give me 1 minute. All right, good evening, everyone. We will start exactly at 7:05. It's good to see hi Enid. It's good to see everybody.
Hi, how are you, Miss?
I'm fine. I'm at work, but I had to cut down on my I'm working the elections. I had to cut down on my lunch so I can use this time to pull away from the table to have this meeting. So I'm happy to see each and every one of you. The meeting wouldn't be too long. It's now in 1 minute we will start officially. I hope all of you are having a good week. In spite of everything that is happening in our world, in our communities, and outside of our communities, we just want to support our brothers and our sisters in our community. Just give them our support as to what's happening, with their families. We just hold space for our the Jewish community as to the families, as to what the families are going through right now. I know a lot of our people in the community, they have families out in Israel, and our hearts are with them, and we are supporting them. So just let them know that we are there for them, and we are supporting our community. We are supporting them. As we move on, it's now 5:05. My question on the floor today. Now, as I've just welcomed each and every one of you. So I just want to ask one question, one word answer. What was the highlight? How was your day today? You unmute yourself and answer. How was your day today?
Well, I guess my day was, I would describe it as satisfying.
Okay, let's move on to the next person.
My day was long. Too long.
My day is long. So my day is just like you, long. Derek, you're muted.
Rewarding.
Oh, wow, wonderful. It's good to hear that. Wow, great.
Yeah.
Yeah, Yusuf?
Hi, everyone. I'll be honest, it started off on the wrong foot, but then it got better. So always have to think positive.
Definitely, definitely so. Definitely. What about Anna?
Hi, everybody. Sorry, my video's not working well. My day was okay. Thank God. Thank God. It's been a good week. Got a lot
Wonderful.
of cases done. Yeah.
Yeah, and Mia?
I would have to say funny.
Funny?
We have a few. It's never a dull moment at CB9. So.
Oh, tell me about it. Yes, as I said, mine was long. It's still going. I'm supposed to be finishing at 8 o'clock. So we are still here. I don't see any newcomers. Justin, are you new with us? Okay, so Justin
Yeah.
is here with us. So I'm just going to introduce myself. So we'll just go around and introduce ourselves quickly. My name is Francesca Leopold. Second Vice Chair, Community Board 9, and the Chair for the Health and Social Services. I just want to welcome those of you who are joining us for the first time. So we'll just go through the screen as I see you, in the order that I see you. I'll call on you to introduce yourself. So I'm going to call on Derek to introduce himself.
Hi, good evening, everyone. My name is Derek Dunn. I've been a part of I've joined a couple of the community health board meetings back in 2019. I'm just back again. Wanted to offer some stuff from NYU on the health side. So I'm honored to be with you guys.
Thank you. Thank you, and welcome again. Welcome back. Your first day looked familiar. I was wondering. Justin?
Hi, Justin Perkins. I don't know. I was just joined as a resident member, and just hoping that I can help out and add on any way that I'm able to. Been working in the nonprofit field and human services for about 18 years now. So
Thank you. Enid?
Hi, good evening, everyone. My name is Ina Dillard. I'm the Senior Director of Marketing and Communications for One Brooklyn Health, and I've been a member of the Health and Social Service Committee for about 3 years now. Very happy to be here.
Thank you, and thank you for all the help. Anna?
Hi, good evening, everybody. Nice to be here. It's my first time at this committee. Thank you so much for inviting me, Francesca. I've been working with elected officials, but recently I've now with a not-for-profit IDCC, which is a mental health clinic, but I'm also part of a new program called Connect IDCC, and I'll leave the details for that later.
Thank you so much, and welcome. Welcome on this platform. Yusuf?
Yusuf.
Okay, Yusuf is kind of far away from us. Darian, I know she was not.
I'm
Okay,
here.
Okay, cool.
Yeah, hi everyone. Joanne Saab. I've been a community board member since I believe like May 2023 or April 2023. I am a research scientist at New York City Department of Health. And what else? Oh, I'm secretary for the Health and Social Services Committee. Good to see everyone.
Yeah, thank you. Mia?
Hey, good evening, everyone. Sorry for being off camera this evening. My name is Mia Hilton. I'm the Assistant District Manager at Brooklyn Community Board 9, a resident of the community, and happy to join you guys here this evening.
Thank you. Thank you, all of you, for coming. This afternoon, we will be having a short presentation from Anna, and as she said, as she introduced herself, she will give us a little bit more as to what IDCC does. I have been to the location many a times. Early in this year, August, we had a shower in the city, which was very successful. And I think it is something that we should at least have once a year. And the programs and services that they do bring to the community is very vital. And I'm very happy that she's here. And now I'm going to turn the floor over to Anna. As she said, her camera is not working. So you'll be hearing her voice, but you will not be seeing her face. So just pay attention to what she has to say. Anna, welcome. And now the floor is yours.
Thank you so much, Francesca. Yes, it's really been a pleasure working with you. You wear a lot of hats, so you bring a lot to the table, and I really, really appreciate that. So let me begin a little bit about Connect. This program was started about 1.5 years ago under DOH. We're part of the Interborough Clinic, but there are 9 Connect programs throughout the city. 3 are in Brooklyn, and the rest are scattered throughout. The other Brooklyn sites are Williamsburg, and in Brownsville, they're part of Housing Connect. I'm sorry, Housing Works. So basically, the idea of this program is to enhance mental health. In other words, you have clients that come for mental health treatment through our regular IDCC program. We have regular mental health, counseling. We have psychiatric evaluations, psychiatric services, and a whole slew of things. We have, programming for children, etc. But I guess it's because we're under DOH, so they decided that there should be like the next level up, meaning not just help with the person with talk therapy and of course their mental health, if they need medication and so forth, but also the person as a whole. In other words, if someone has issues with their rent or they're going through eviction, you can't really concentrate on working on your mental health because you're so busy figuring that piece out. If someone has issues, let's say they are on SSI, SSD, food stamps, and they're not getting their food, they can't concentrate on their health, their mental health. So we do have, where each program kind of tailors it to the needs of the community. We go out to the community, we do surveys, we go to different meetings, and we see what are the needs of the community. We have short surveys. We're actually recreating a newer detailed survey based on a lot of the feedback and the priorities. And the 3 categories that we're going to be focusing on is public safety, housing, and mental health. So we're in the middle of creating a newer, more tailored survey based on like a lot of the data that we have collected since the beginning of our term starting this program. And that said is, Francesca mentioned the shower in the sea. I'll get into a little more detail in the program, but I just want to highlight that Francesca mentioned shower in the city. Shower in the city, I like to give credit where credit is due. It was an event a couple of years ago when I was still working for council member Mealy or Cumbo. I don't remember which one at that time, but this was done by God Squad. It was on the corner of Utica and Eastern Parkway. They set up, the mobile shower, which actually Eric Adams had done when he was borough president. Some, food stands, some clothing, and it was just a one-stop shop. So we saw that event. We asked if they would partner with us, and we decided to do it bigger and better. Last year we had 40 agencies giving out clothing, giving out food, social services, and of course the shower bus, and it was very successful. It took a lot of work, pulling a lot of pieces together, but thank God, I think the people definitely benefited. Last year we had financial literacy, we had public safety forums. So we're not, right now we're in the middle of, actually, we want to think about doing a caregiver support group. And afterwards, I'd like to get your feedback on that. Do you think that's something important? Would you participate? Where would I do it? I'd love to hear your feedback when I just tell you a little bit of outline of the program. So the program is as such, we help with benefits, housing, and vocational. That's our three main areas. We have a housing person. So if you need a one-shot deal, if you need help, advocating for a one-shot deal, going down to the fair hearing, just going down to HRA, that's Missy Perez. Other benefits, the benefits person is now Lindana. Okay, Lindana, oh my God, Fortune, thank you. Sorry, I'm just going by heart here. Lindana works with benefits, and she also does vocational. Now, the beauty of this program is it's not just like you come and you get seen, but we also come to the client if they want that we come with them, or we go with them to appointments. Not a lot of people, agencies do that kind of thing. The other day, someone called me, she got her one-shot deal, but it was a lot. Missy went down with her. It was a 4-hour thing that, waiting for HRA to speak to somebody. So, a lot of people get very intimidated, very nervous going down for their appointments. So this is one of the things we do. We also would meet them in a coffee shop. We meet them in the park, whatever. We meet people where they're at. And then of course the vocational piece. So Lindana helps with that. We also have a peer. We have our own therapists. And we do also a food pantry. We had to stop because we're under construction, but we just had a giveaway, and we're talking about doing another food giveaway in a couple weeks, hot food with some other things before the holiday. So it's really like a wraparound services. And, the program is just starting, and we're getting to know the community. We're out there, and we'd love to, if anybody has any questions, is there a chat box, Francesca, that I can put my email in? I don't hear you.
Oh, no, there isn't a chat, Arna, but I'll send your contact to the committee if you don't mind.
That sounds great. And again, I'd love to hear feedback about doing a caregiver support group. If anybody wants to weigh in, tell me what you think. If you have a suggestion on a convenient place for everybody, I'd love to hear.
I'm so sorry, Anna. I was responding to you, but I was muted. I didn't realize that. Yeah, and so Mia will send you the information, and then you could send it to us, and each person will receive it. So the floor is open. You heard the presentation on what IDCC, what they are doing in the community. So if anyone have any feedback, any comments, any questions you have for Anna, we have a few more minutes. Please do so.
Hi, this is Yosef. I just want to say that Arna is one of the best people in the community. I know firsthand how she really, really helps people on an individual level, and people should not feel shy to reach out to her, or if you have a neighbor or a family member that needs help. Arna really, she knows the system, and she'll hold your hand and get the job done. So I could testify firsthand that you could trust her and put her to work. She really cares about people, and she does a great job.
Yes,
Thank
I
you
can
so
attest to that too, definitely.
Can I give a shout out to my colleague, Mr. Hirschkopf, if I may? I don't know if everybody's doing a presentation on their agency, but Yosef actually works at Cayman Health. It's the urgent care on Lefferts in Kingston. And he, there are times when sometimes you need to speak to somebody, COVID questions. Can I come in? Is now a good time? Do you have an x-ray machine before I, go out of my way and come into yours? He's really helpful. So just like to back at you.
Thank you.
He's part of the committee on the board, and he have offered his services, and definitely will be working with him. Anyone else have any questions? I have based on the services that are being offered, especially in the housing area, with the one-shot deal. What areas of the community are you servicing when it comes to that service, Anna?
So basically, our grant is for Crown Heights. You know, 11212, 11213, 11225, but we also do like a little bit farther. We have a little bit of bronze. I think we have 16, we have 33. So like if somebody comes, let's say East Flatbush, we're not going to turn them away, but we may not be able to go, you know, do the thing that we, you know, go to your home, but we definitely can serve you. Now, the clinic is open for everybody. You could be from Brooklyn, you could be from wherever. That the clinic is for everybody. Just our program is a grant program, so it's focused pretty much on Crown Heights. But again, if you have someone nearby, not that far, let's say East Flatbush or Bed-Stuy, we even have some of these zip codes, then we can definitely try to service you.
Okay. And something else I'm also looking at, it's that the last time then when we had the One Crown Heights Fair, we had a lot of persons who came, and then we had services at the park. But one thing that I noticed, and I think that whenever that we are doing anything out in the community, that what we should do is to really bring out a van, especially the HIV van, because persons was coming up to me and then they were asking. So any one of you who are having any services, any sort of services, always remember, you know, put that on your as part of your agenda, things that you should bring out as well, because persons were really coming up asking for that. I just wanted to put that out there.
Thank you.
Thank you. Anyone have any questions for Anna?
Where is it located? Because I do see people in the field, so I can direct them.
Sure. 921 East New York Avenue.
921 East New York Avenue.
I'm gonna send our flyer to Francesca, and maybe she can also email you guys the flyer as well.
Please,
yeah, so send it over to Mia, and Mia will then already have a contact for information for every person who's represented here tonight, and then she will forward it to them. Any other questions? Anybody
so I'm
else?
visible over here on the side. I'll just peek in on the side here. I don't know what's with this laptop, but
yeah, I could just see a piece of your face.
All right. Anyway.
Yeah. Thank you so much, Anna. And I go ahead, Ian.
Yeah, I have a question. Thank you, Arna, for that presentation. Really great services that you provide, and wraparound services are super important. But I wanted to know, do you serve undocumented individuals?
I think so. That's a great question. I don't want to say it definitely, but if you send me an email, or if Mia, you know, Mia's going to send my email out. Feel free to email me and I'll ask my supervisor. I think we do.
Yeah, if I may chime in, and then most of the time, non-for-profit organizations, they do serve undocumented communities. And then these are some of the persons they really look out for, because they know that the services that they really need sometimes being undocumented, it hinders them from getting it. So a lot of the, especially non-for-profits who are really getting grants and stuff, they really do serve the persons who are undocumented. So if no one has any more questions for Anna, you can stay with us.
Francesca?
Yes.
Can I do a shout out there? I just want to say hi to my colleague, Enid Dillard from Kingsbrook. We worked together in the past with the CAB, and she's a great resource.
Oh, yes,
thank you, Arna. I say the same about you. It's so good to see you.
You as well. Thank you.
Yes. Thank you so much, Anna. I hope you can just hang on with us, and I would appreciate if you can, we usually meet the first Thursday of every month, because there is a lot that your organization is doing, so that you could come on and just share with the community as to what's happening. So it would be a pleasure to have you joining us on a monthly basis.
Will do. Thank you.
Yes. As we move on, thank you again. And as we move on, we're going to do a community check-in right now. So I'm going to call on Justin. Justin, is there anything you would like to share with us, or anything you would like to, any think that you want to bring to the committee so that we could move on? Because everything that we are doing our meet, when we have a presentation, we have a presentation, but whatever that we are doing, we are planning, we are really planning for the new year 2024, so we could start 2024 with a bang. So I know that you said you'll come to join us, and I'm sure you joining us is because you have something of relevance to bring to the committee. So we'd like to hear from you for 3 minutes.
Yeah, well, I mean, I didn't come prepared today with anything to bring specifically, but I am just excited to be here. But you know, I just want to learn for now, just sort of see what's happening, and then sort of be able to jump in maybe a little bit later at the next meeting. I'll have something more more meaningful to bring and more insightful. But I'm just sort of just like absorbing and listening for the moment.
Wonderful. Yeah. Wonderful. Thank you. Thank you.
Yep.
Enid, and welcome again. Looking forward for you to be with us. Don't come to the end and disappear. I want to see you again, be part of the family.
So last time Ms. Brown was with us with the committee, she gave a presentation about the transformation of one of our hospitals, Kingsbrook Jewish Medical Center, and all that's happening there. But the one thing we discussed as a group is what we wanted to do moving forward for long-term care and for our seniors in the community. And so we really want to be able to be a partner in that and open up our ballroom at Kingsbrook for whatever small events we can host, because I think that was one of the things that we were looking at as a committee. Where can we hold these events? Kingsbrook is under a transformation. They're becoming a medical village. So there is a lot going on there. However, I think we plan early enough in next year. I think we can get something going for the seniors. So just want us to really start thinking about what that would look like so that we can start figuring out how we can accommodate.
Thank you so much. I really do appreciate, because we don't have many places where we can hold events for the seniors. And then I do appreciate when Ms. Brown was here, that she made it available that One Brooklyn Health could assist us so that we can have a place where we can bring the seniors together, because there are a lot of things that we are looking forward to. And as I've said before, I want each person who's represented here tonight to think of something grand, something good, something that you would think that you would love your mom, your grandmother, your aunt to really get from the community. Because sometimes when we sit, we said, what are they really getting? And we have our parents, they work so hard, for our communities. They give back so much of themselves, and we want to give them back something, and something you would like us as a community board, as a community, to do something for our seniors. So everybody, I am expecting that you will come next month. When you come with something, or send it to the board, and so we could put it as part of our agenda and have a discussion, because I really want us to have a very productive 2024 when it comes to our seniors. Derek, let me hear from you.
Okay, so good evening, everyone. As I spoke before, I've been a part of this committee in the past. I've worked in the health insurance field for roughly 20, 30 years. I'm here today. I'm working with NYU and the Ascend program. NYU is doing a case study of obstructive sleep apnea and its effects on its possible effects to higher Alzheimer's disease in the African American community. If you didn't know, the African community has a higher rate of Alzheimer's than the non-Black and brown population. So what NYU is looking for is individuals that are in the ages of 55 and older, male and female, to possibly join the study. So the sleep study is roughly a year study. NYU pays for all of the blood work, tests, like the sleep study test itself. They pick you up, they drop you off at to the facility on 23rd Street. Everything's paid for, and they also pay the individuals that are selected for the case study $800. So the doctor that's conducting this study, Dr. Boo Boo, I would like to have him join the next session next month to discuss it more in detail. But this is a pretty good a program in the community. I was at the office, the district office on Halloween, actually. So I dropped off a couple flyers, but I would like to, submit some of this stuff to you guys.
Ms. Fran, you're muted.
Yeah, everybody's muted.
Yeah, I'm here now. I'm here. Okay. Yeah, and thank you so much. I'm totally looking forward to that, and just send the information, the name and everything to the office, and the office will then make it part of the agenda when we set our agenda. And we're definitely looking forward to having him come present for us. And
Okay.
and this is really what I'm looking for. I really want the community to really get involved in the work that we are doing, because there is so much more that needs to be done. So as I said before, any ideas that you have, just bring it forth to the community and invite your friends. It's a community space, but I warn you, when you come, you become part of the family, and then we hold you, so we don't let you go. What did you say, Derek? You're muted. You're muted.
Yeah. You can't miss me. I'm about 6'9". And I live across the street from the district office building. You cannot miss me. You cannot miss me.
Wonderful. Thank you so much. I thank you for sharing, and I'm wanting to work with us. Let me hear from you, sir. Is there anything happening on your side that you would like to share with us?
You were trying to reach me?
Yeah, anything that you would like to share with us or happening on your side?
Yeah, I wasn't, I mean, obviously I've just joined the health committee, so I'm excited to learn from everyone else. As Arna shared earlier, I'm a very accessible guy. Anytime anyone needs to see a doctor and their primary care doctor is not available, or they have whatever else is going on, people can reach out to me. I'm accessible like probably 18 hours a day, 6 days a week. And I'm proud of what I do, of what I bring to the community. I am probably the only urgent care manager in the whole America that lives walking distance from his office, and I take full advantage of that. So people could definitely reach out to me. If there's a way for me to share my contact info with everyone, I'm happy to do so.
Okay, wonderful. Thank you so much. So the last time, anyone else would like to share, Dorian or Tara or Nyasha? I see Tara. There anyone else would like to share with the community if there's something that you would like to bring forth to the table, something that you are doing, your organization is doing, that you would like to share with us?
Hi, this is Teresa Westerdahl, aka Tara. I'm on the community board and on the environmental protection committee, and our meeting was canceled tonight. So I just thought I'd pop in and see what you all were up to and what was going on. It was great hearing what's happening in your committee. There's one question that came to my mind while I was listening is I have a senior neighbor, like upper 80s, early 90s, who's been having some ongoing issues, and she has a brother and with a similar age. He lives in Bed-Stuy, and they've been having a home health aide. There was a robbery, and she lives very close to me. I live over near Ebbsfield, and I'm trying to help her, and I had her call Crystal's office, but she really needs some type of like senior support for this situation. And I don't really know what to do. She's trying to help her brother. He's had a stroke. He's been in the hospital. She's visiting him. And it's quite difficult because, transportation problems with elderly people aren't so great here. And I just want to, help her. And it would be good if there was a specific agency that could help her, because I don't have the answers. So is there a senior?
Anna is not I. Teresa, what I would really love for you to do, if you can pass on those persons, the addresses, the telephone numbers, whichever way that we can contact them, because there are a whole lot of services out there, that could help them. So if you can just bring those services, bring the contact, or leave your contact information with me at the office, and I will get those information from them and reach out to them. And if there is anyone online right now who wishes to chime in and say anything, please go ahead and mute yourself.
Yeah, sure. I actually work for a home care agency. So what happened? Did the aide actually stole something from her
I
home?
go into too much detail. You
Yeah,
know,
yeah, I understand.
I would like, it's not easy for her to even call a lot of people,
Hmm. I get
and
it.
she calls me like her phone is often broken too. We have had a lot of trouble with Verizon in my neighborhood. So her
Hmm.
phone is not working. So I have to wait for her to call me even, and I don't feel comfortable just giving her number out to a
Of
bunch of
course.
agencies.
Sure,
I
sure, sure.
like
So
to
that's
have
the reason why I said to you, don't
a
give the information
contact
now, call the office. I will get the information from them and then we'll take it from there.
wait,
Because
wait, wait.
the only way
Before
that we can
I
help
call,
them, we need to know the issue.
yeah.
Okay? Yeah. And
Is there
then
an agent? I don't feel comfortable just leaving her number at the
so
community.
if if anything, I will I will touch base with Derek and then we will get back to you. Mia will gonna
Sure.
give me your information and then we'll get back to you for whatever. Because if you are seeking for help for somebody, we don't need to know everything that is happening, but need to know what we are dealing with so we can get the appropriate services and appropriate information for them.
Is there a
So
specific
There's an
agency?
agency, can I just chime in? There's an agency called Heights and Hills. That is
What-
like I think they do case management. I believe they're located somewhere in downtown Brooklyn near Crystal's office. But you need to call them and there's a waiting list. So you can call them, put her on the waiting list, but then it sounds like, Fran might have some resources that are much more readily available in the meanwhile.
And then the MLTC, whatever MLTC they have, also has case management as well. So the brother or the sister should have case management to assist her as well. So that's why I was asking, what was going on. But yeah, so definitely reach out, and they'll coordinate everything and try to get you the best information they can to help your neighbors out.
Who's they? Who do you mean they?
The chairperson,
myself,
Miss
we
Francesca.
will,
Francesca.
yes, so we'll get, if I can get I will touch base with
No,
you.
would you prefer if we would just put you in contact directly with Miss Leopold via phone and you guys can discuss it and take it offline that way?
Agreed.
Yes,
Yeah, or
definitely.
even
Cool.
good.
So we'll do that. I'll give you, Fran, are you okay with your direct number being provided to Miss Westerdahl?
But yes, I don't have no problem with that.
Okay, that's fine. Miss Westerdahl, I'll send you over Mrs. Leopold's contact and you guys can take it from there.
Thank you very much, Mia.
Was
Okay,
my
so I have to go back to the meeting. I have to go back to work. So I'm gonna try to move on with the meeting. So I will touch base with you on the side, Ms. Westerdahl. As we move on with Yusuf, and I think everyone here. So last year, was it last year? Was it last year, Enid, that we had the mental health forum, or last year or this year?
That was last year.
Last year. Okay, so we had part one, and it was, I mean, everyone who came on, they were very happy with it and the information that was given. And some of with the discussion, persons were like, hey, we didn't know this, they didn't go with this, we didn't know there was a difference. So I'm looking for us to have a second part of that discussion. I know that I love in person, that it feels more intimate and persons are there. But sometimes when I look and I said, okay, because of person scheduling and they're working, when persons get home, it's easier for them to just log on and to come on but then in person is very good. So, but then it's getting cold. Well, it's not getting cold because we'll be doing this next year. So I'm looking for us to do the mental health or wellness again, and have a part two of it, and have a different panel to really come on and discuss, because mental health is going nowhere and it's affecting not only the old, but the young as well, young children. So I want us to have I think the last time when we had it, we really focused on the elderly and the adults. And I want us to have one concentrated on the young people, the younger ones. So that is what I'm looking for us to do. So let's just work our minds around that, how we're going to go around doing that. It is a we thing, as I always say, it's not a Francesca thing. So we can come up with ways. Is it better to do it on Zoom, or whether we're going to meet in person, to do it? So, but we are more focusing on the younger children, school age children, and younger adults, how it affects them. And then also, I'm also looking for us to do the maternal health, maternal health forum. And so these are the things that I have in place. So we have 3 things I'm looking at to do the senior programs. And the last month, there was this young lady who said that they were having a program almost like the seniors party at the YMCA. Can anyone remember, is it this weekend? Because she did send me a reminder, but I was working this weekend, and I really wanted someone from the committee to represent the committee, because I will not be able to make it. Dorian, do you remember as to which day that the young lady said that they were having the program for the seniors? I think it's part of the minutes. So if you could just look up the minutes and just,
Do you know what meeting is it from? From the last meeting?
Yes, you presented last month.
Oh, Diane Smith. It was on Senior Appreciation Day on November 3rd. That's
At the
tomorrow.
YMCA, right?
I think so. And then she was supposed to share. Did we get a flyer?
Mia, did she send a flyer?
I know the flyer was supposed to be shared, so I don't know.
I don't recall receiving one, but I'll go back through the email just to double check, and I'll check with Khalid as well.
Yeah, if you do, yes, if you did receive something from her, if you could just send it out to the committee, because I myself, she did send me an email reminding me that she would really love for me to be there, but it's just beyond my control that I wouldn't be able to make it. But then, as anything else, we are looking to do senior program next year. So I don't want us to I want us to do something good for the seniors. Although we had the seniors party, because of the weather, it didn't come out the way that I wanted. We had a few seniors. So I'm looking for the summer coming up that we could, I think Dorian had a great idea. Dorian said we're gonna have, what was it, Senior Olympics Day?
I was thinking about perhaps a Senior Olympics, and this would be in the warmer months. So I went to Barbados, and I saw like they had they advertised a Senior Olympics Day, and I was like, oh, that'd be really cool to do something like that in Brooklyn. So I think it's just seniors coming together, do different physical activities. I mean, it could also not be physical activities, but I thought that was just a good way to bring the community together, do something that's physically healthy. Maybe perhaps like have vendors there, screenings, all in this one place, this one day.
Yeah. So we are looking to do that. Then also we are looking to take them out. I'm like to take them to a Broadway show, and then take them for lunch afterwards. And then we're still looking to do the spa day for them, and then I would like for every quarter for us to do a health segment for them, bring them together, and have someone come in and just talk to them about, about the healthy cooking, and show them just have to prepare simple stuff, for them, and then do little exercises with them, so that is during the month we can have transportation, go pick them up, and even as we can use the room at Kingsbrook Jewish, we can take them in there and then just bring them together and have little exercise program. When we had this party, we had one lady who did laughing yoga. It was just hilarious. It was wonderful, and they had such a wonderful time. And
What
then
kind of yoga?
laughing yoga. It was so great.
Oh,
You would love it. Yeah, it was great. So we're looking to do that next year. And then we look into the mental health awareness, and the second part of that for the youth and the younger ones. And then also we are looking to do the maternal health. And I would like us, I think Dorian did mention something else as well. Then I would like us to be the first school that we should go to would be the MS 61. So to bring a health program in there. for the parents. And Dorian, go ahead.
The idea was to have a from Department of Health, the teen health program has really focused on really showing teenagers how to consent or talk about consent when it comes to their sexual health. So how to really talk about sex, how to decline sex if they're not comfortable, or unwanted touches, just unwanted advances from their peers, from others older than them. So it's just a way for them to like talk about sex in a healthy way. And so it's an initiative from the Teen Health Program at Department of Health. And they also have another program around intimate partner violence. So it's possible.
And then we also want to highlight HIV, because when we look at the statistics, it's really not out there, but a lot of young people in the neighborhoods, they do have HIV/AIDS, so we also want to bring that awareness to them as well, as to how to prevent that. Okay, so as we move on, so just think of the things. I just hope that you're taking notes. And I have 2 items. It's now 7:46. I have to cut off at 7:55 to go back in, because we're shutting down at 8 o'clock. And so there are 2 things I have. New business. We don't have any old business. Whatever in old business we had, we just spoke about that. So in new business, the 2 items I have to present, there is a resolution. Mia, if you can just give a little synopsis on it, and I need the committee to vote on that, because it has to be presented to the board. For the last time, the lady who came, she presented, and it was for Medicaid. And so
yes, yes, we had a retiree pop in last meeting, who essentially has been making the rounds to local community boards, who were essentially looking for support for New York City retirees to maintain regular Medicare coverage and not be subject to the Medicare Advantage plans that would leave them open to marketplace rates and jeopardize their fixed incomes depending on their health situation. So essentially they're making their rounds to local community boards, asking for community boards to pass resolutions, urging elected officials to support legislatures that would protect the Medicare coverage for New York City retirees.
So the majority of you were here. Thank you, Mia. And then so I'm just putting a motion on the floor for us to present it to the board. So please open your unmute yourself. Members of the committee, members of the board, please unmute yourself. Dorian is there. I am here. Who else is here? Yusuf is here. We have Enid. Mia, which is community members can vote as well, right? Who are part of the committee.
Yes, the resident members may vote.
Okay, so so it's open. So you heard the spill, so it's on the floor. Can I get I put the motion, and only second it, please?
Yes, I definitely do.
Okay.
I do as well.
Yeah. Thank you.
It's a yes for me.
Okay. It's a yes for me. Yusuf?
Yes.
Okay. Naisha? Okay, Naisha is not here. Go ahead, Justin, because you become part of the hood. What is it on the floor?
Yes.
Okay, so there are I would say 8 of us online right now, and Anna.
Okay, I'll vote as a community member right now, and on that note, I'll say yes.
Okay, all right. So the 8 persons represented here, Mia, please recorded that everybody voted in favor. Okay, thank you. As we move on, as you would have heard, Dorian, are you in a position to turn on your camera?
Sure.
Okay, so I would like to put it on the floor that Dorian is part of the board, and then she is the the secretary for the committee, and I would like to make her co-chair for the committee. So in my absence, if I'm not here, then she'll be able to carry on the meeting. And she will be reacting on my behalf. The committee, every business will go on as usual. So I would just like to, for a vote, that we vote her in as co-chair for the health committee. Do I get a second?
Definitely second.
Okay. All those in favor, please unmute yourself.
Aye.
Aye.
Yusuf?
Sorry, I was just spaced out for a second. What's going on?
Yes, I would like for I'm nominating or asking for Dorian to become the secretary of the committee, to become the co-chair of the committee.
Sounds good to me. I'm in. I say yes.
Okay, thank you so much. So Dorian and Mia, is there anything else I need to do that has to be done?
Nope, as long as it's noted on the record, you guys are good to go.
Okay, so welcome and congrats, Dorian. You are now co-chair. Dorian has already set the WhatsApp group for the chat, so I'm assuming you all would have seen your names on the WhatsApp. So Dorian, Mia will send you Anna's information, Justin's information, as well as Derek's information, so you'll add them. So we will have two chats. Transparency, one chat will just be for board members who are part of the board. So if there are anything pertaining to the board that we need to discuss, they will be discussing it. And then we have the other chat where we have board members and community members. So whatever ideas you have, whatever in any event coming up, anything that you think that the community should be doing, whatever, just place it in the chat. You can call, we can text it, or whatever it is. It will be our working. I don't want to see any postings in there. I don't want to see no good morning and no good night. I have enough of that on my phone, blocking my phone. So we just did it only with stuff pertaining to the committee. If there is an emergency and you need to put it in the chat, fine. I'm good with that. But other than that, I don't want to see all the other stuff being forwarded on the chat. Definitely not. Okay. Anyone want to say anything? Any other comments before we close, before we adjourn for the night?
I was just gonna say thank you so much, everyone, and hope to do a good job. So, and for
You
the
are doing a
WhatsApp,
good job so far.
thank you. And for the WhatsApp chat, if you, I guess if you haven't sent your number in, they could just send it to Mia, and then I could add you to the WhatsApp group. Two separate WhatsApp groups for members and residents.
Okay, so thank you so much, and thank you for accepting. And I'm looking forward to us having a very robust and successful 2024. Thank you so much, everyone, for coming. Thank you for your input, for your comments, and looking forward to all of us working together. See you next month, and have a good night and a wonderful weekend, and stay safe.
Thank you.
Okay.
Thank you.
Thanks again. Thanks again, everyone.
Take care.
All right.
Happy
Thanks, Mia.